We welcome you to the Voice the V webinar series sponsored by Gynaguard. Thank you for joining us. My name is Marcel MacDonald and I will be introducing you to our very special speaker, Dr. Sihle, a general practitioner with a particular interest in women's health. But before I do, I would like to tell you a bit more about this webinar. This Voice the V webinar is specifically formulated for the mature woman. We never stop evolving, and with menopausal stages come new changes to our bodies, and specifically to our intimate areas. And that is why Gynaguard created this webinar series, to talk about body and hormone changes and how it affects your pH balance through the different stages, namely puberty, motherhood, and menopause, with the aim of empowering women to have a voice in a safe place. Gynaguard's Voice the V webinar is a safe place needed to make this a possibility. Real facts, real truth, real openness, plus we offer you a solution to symptoms such as odor control, dryness, irritation, discomfort, keeping you feeling fresh, clean and confident daily. We are giving away a Gynaguard product hamper. To stand a chance to win this beautiful hamper, put your comments and questions into the chat section of the webinar. T's and C's apply. We are pleased to welcome Dr. Sihle, an advocate for education around conditions that women experience. Welcome, Doctor.
Good morning. Thank you for having me, and thank you for that lovely introduction. And as you said, my name is Dr. Sihle, a digital doctor from Prime Medical Solutions. I am a general practitioner with a particular interest in women's health. I'm an advocate for education around women's conditions and the conditions that they experience, and finding sustainable solutions to help them. Even though I have not experienced menopause myself, I have assisted multiple women to navigate the stage of their lives. Okay, so let's get going on this very important topic. Okay, our bodies are constantly changing as we progress in life, from when we start our period to the end of our menstruation days. You know, as we start to think, I'm finally understanding my body, we enter a new phase of life, and it's like starting all over again in terms of understanding our bodies. As our bodies evolve, we experience different concerns that we can sometimes feel too self-conscious to talk about. Firstly, let me tell you that you are not alone. The things you might be experiencing are experienced by millions of women in the world. So you shouldn't be shy to talk to your healthcare provider about these things. In fact, 50% of women in South Africa experience vaginal dryness during menopause, but only 60% actually seek help for it. So let's break the silence and the shame associated with these conditions that we all experience, and let's find ways to help each other navigate through these various stages of life. So to really understand the changes that we go through during menopause, we need to understand the hormone changes that occur during this phase of our lives. So come with me, let's take a journey back down to memory lane, to puberty. You know, some of us might have had some acne problems, you know, the growing pains. So let's go back to the puberty and those first stages of menstruation in order to understand the changes that one might occur during menopause. Puberty is a stage where we experience physical changes in our body because of hormone changes that are taking place. These physical changes result in our bodies transitioning from a pre-pubertal body habitus, where there's not a lot of breast formation, there's no pubic hair, and there's no maturation of the sexual organs. And we evolve a more adult-like physical structure, where you start to develop breasts, you start to develop pubic hair, your hips start to become wider, your fat distribution in the body changes, and there's obviously maturation of the sexual organs. And with the maturation of the sexual organs, we reach our menarche, which is the first occurrence of a menstrual period. Personal story here. I remember being in grade 7 and my best friend started a period, and our schoolmates around us were also starting their periods. And I was there, you know, 13, haven't started my period. And I'm thinking, there's something wrong with me. And I'm thinking back to my sister who's older than me, who was 13, and she'd started her period. So I'm thinking there's something wrong with me. You can obviously imagine my relief at the age of 14 when I finally started my period. And that's the thing about bodies and female bodies, is that not everything's going to happen like other people. Not everything's going to happen like clockwork. There isn't a perfect age for anything, because we're all different and we develop at our own pace. So just because your friend or your neighbor might have experienced something doesn't necessarily mean that you will experience it and that you will experience it at the same time as them. Even with menstruation, the average age of menstruation in South Africa is 12, but people reach their menarche between the ages of 9 and 16. So let's hone in on the changes that take place in terms of hormones. And we're going to delve deeper into how hormones affect our bodies. So we have this part of our brain called the hypothalamus, and the hypothalamus produces a hormone called gonadotropin-releasing hormone. I don't know if you can see my points on the screen here. This gonadotropin-releasing hormone sends a message to another part of the brain called the anterior pituitary, and it sends a message for this part of the brain to produce another hormone called luteinizing hormone and follicle stimulating hormone. I'm going to call them LH and FSH from here up on. These hormones then send a message to our gonads, which in the female is our ovaries, to produce two sex hormones. These hormones are estrogen and progesterone. Estrogen plays more a part of the physical changes that take place during puberty. Progesterone is more important when it comes to pregnancy and preparing the body for pregnancy. So these sex hormones, like I said, are responsible for the physical changes that take place during puberty, and that results in the maturation of our breasts, ovaries, uterus, and vagina. Menstruation is regulated by a complex interaction between these four hormones, being the LH, the luteinizing hormone, FSH, the follicle stimulating hormone, estrogen, and progesterone. There are 3 different phases of the menstrual cycle. And if you have a look at this graph that I've put up here, we're going to try and break down 3 phases of menstruation. So the first phase is the follicular phase. This is before the egg is released. And you can see it here just between day 0 and day 4. So the levels of estrogen and progesterone during this follicular phase are quite low. Because of these levels being low, you'll see that our uterus lining is shedding. That means we are having a menstruation. During this time, there is a very slight increase in FSH, which is the follicle stimulating hormone. This causes several follicles being fluid-filled sacs that actually contain the egg inside them. And FSH causes these follicles to start developing. So we've got multiple follicles developing at the moment. The FSH level then slightly drops, and that causes only one follicle to continue developing. And this follicle, while it's developing, actually starts to produce estrogen. Now, let's go to the second phase of the menstruation cycle, and that is the ovulatory phase. This is when we're actually going to release an egg, okay? And you can see it's happening at about day 4 to day 14. Once again, these are just estimates of days. Every woman is different, and her phases, one phase might be longer than the other, but we're giving you just a general overview here. So the second phase, the ovulatory phase, this is where the egg is actually released. What causes the egg to be released is that there's actually a surge in our hormone levels, specifically the LH, the luteinizing hormone, and the FSH, the follicle stimulating hormone. And you can see that in this graph, that the LH being the red line surges. And you can also see FSH being the green line starts to increase. And those 2 increases are what cause the egg to be released from the follicle. The estrogen levels then start to decrease. You can see the estrogen is the yellow line. It's coming up and it's starting to decrease. And the progesterone levels start to increase, the progesterone level being the blue line. Why this happens is that once the egg is released, the body starts to prepare that this egg may be fertilized and then implant into the womb. That puts us into our third phase of the menstrual cycle. We're looking at about day 14 to about day 28. This is after the egg is released. So FSH and LH start to decrease. So if you look at FSH, it's the green line. It's starting to go down from where it was in the second phase. And LH, which is the red line, you can see is very low at this point. The ruptured follicle itself, which you can see right at the top of the screen, that white-looking sac, seals itself and forms a structure that we call the corpus luteum. This structure's main purpose is to produce progesterone. Remember, the body at this stage is hoping that fertilization is going to take place and that this egg is going to implant into the womb. And so that's why we're producing progesterone, which is what we call the pregnancy hormone, which is going to maintain the pregnancy. The progesterone and estrogen levels are high, causing the uterus lining to thicken. And as you see, right at the bottom of the screen is our lining. And you can see that the lining is starting to thicken in preparation, hopefully, for a pregnancy. If there's no fertilized egg, that corpus luteum, that white structure right at the top of the graph, breaks down. The progesterone levels decrease. The estrogen levels decrease. And we go back to day 0, where we see the lining of the womb shedding. If the egg is fertilized, that corpus luteum structure, that white structure right at the top of the diagram, isn't broken down. It continues to produce progesterone to maintain pregnancy. So that's just giving you a small overview of how the hormones play an interaction in order to produce a menstruation. Because when we're talking about menopause, we're going to need to understand what happens to these hormone levels, and that produces some of the symptoms that you might be feeling. Okay, so let's get into the core topic of what is menopause. The word menopause comes from a Greek word, menos, meaning month, and pause, meaning to cease. So menopause is the cessation of a woman's monthly period. True menopause is defined as 12 months without a period. So before you hit true menopause, you'll experience irregular periods. The periods will come, the periods might not come. But once you've hit 12 months of no period at all, that's when we consider that you've hit true menopause. It's difficult to put a set age to menopause because it happens at different times for different women. Like we spoke about that. Even though we've got estimates, everybody's body is different and everybody's going to react differently to these changes in hormones. It's usually around the age of 40 and above, although some women may develop menopause earlier due to surgical or medical processes. Okay, so now let's go back to these hormones that we spoke about. So remember we said that the pituitary gland is supposed to produce 2 hormones called LH and FSH, and that these hormones are supposed to send a message to our ovaries to tell our ovaries to produce the sex hormones, which is estrogen and progesterone. What happens is that the brain continues to function as it should, telling the ovaries to produce these glands. So LH and FSH is being produced and it's going to the ovaries and telling the ovaries, I want you to produce estrogen and progesterone. But because of the aging process, the ovaries do not react appropriately to this message. And so even though the brain is telling the ovaries, produce estrogen and progesterone, the ovaries are not producing the level of hormone that they should be producing. So what we do find in women who are menopausal, we find that the LH and FSH level is very high because every time it's sending this message and the ovaries are not responding, the body thinks that if I produce more of these hormones, the body will eventually respond, but it doesn't. So that's why you will find in menopausal women that LH and FSH is quite high. Estrogen is responsible for the flow of blood in the urinary and genital area. Because estrogen remains low, because the ovaries aren't responding as they should anymore, blood to the urinary and genital system decreases. This results in thinning of the tissues around the area of the vaginal and urinary system, which we call atrophy. And it also results in a decrease in secretions in those areas. And this is why women will experience some dryness in this area. These changes cause chronic irritation, cause dryness, and cause discharge. The severity of that is different between each woman, but this is just a generalized idea of what might happen because of those decreased estrogen levels. Okay, so the big question, so when can I expect to hit menopause? As I explained to you that it's difficult to put a set age, and like we said, usually we expect it in women from about 40 and older. That is if they haven't had any medical procedures or medical reason that's causing them to go into menopause at a younger age. Women may start to experience symptoms which we associate with menopause before they reach the menopausal stage. We call this the climacteric or perimenopause phase. These symptoms may also continue even after the last menstrual period is reached, but they tend to cease as the transition reaches its completion. Some of the symptoms that women can expect are hot flushes, insomnia, weight gain and bloating, mood changes, irregular period, breast pain, headaches, and then specifically vaginal dryness, irritation, and pain. Remember, like I said, that not all women will experience these symptoms. Some women might experience all of them, some women might experience a few of them, and also the severity of the symptoms will differ between women. So even though today my talk is going to be specifically about the vaginal changes that occur during menopause, there are also other changes that we have to take into consideration. For example, during menopause, our LDL cholesterol levels increase. LDL cholesterol is what we'd consider the bad cholesterol. And estrogen has a protective way or mechanism that keeps our bad cholesterol, the LDL cholesterol, low pre-menopause. Now that estrogen levels have decreased, it's no longer protecting us or having a protective element to our bad cholesterol levels. So we find that postmenopausal women, the cholesterol levels tend to increase, which means we're at an increased risk of developing heart attacks than we were before menopause. Also, one thing that estrogen does do is that it helps to maintain the density of our bones. So what we find in women who have reached menopause is that their bones are much thinner than somebody who hasn't reached menopause. This can mean that a small fall or a small injury can actually cause your bones to be fractured. So it's important that we actually look after ourselves holistically. Today, I'm talking specifically about vaginal symptoms, but there are other elements of menopause that you can discuss with your healthcare provider. We need to continue looking after ourselves holistically in order to ensure that we look after our cholesterol levels. We make sure that our bone density is the right level, and we supplement our diet and we exercise to keep our bodies holistically well. So, as I said today, I'm going to be focusing more on the vaginal changes that one will experience during menopause. We're going to look at what we consider a healthy or premenopausal vagina in order to then look at the changes that are going to occur during menopause. The vagina is lined with cells that we call epithelium, and these epithelial cells respond to the sex hormones that we spoke about previously, estrogen and progesterone. These cells contain a substance called glycogen, which is released after ovulation. And remember, we said ovulation, there's a peak of that estrogen levels. So that peak of estrogen causes glycogen to be released from these cells. Normal bacteria in the vagina called lactobacilli break down the glycogen into lactic acid, which keeps the vagina at a healthy acidic pH between 3.8 and 4.5. So it is normal for the vagina to be acidic, because this acidic environment is important to keep unwanted growth of bad bacteria. As you can see on the slide here, we talked about 90% of the flora in the vagina is lactobacilli. 9% is another different kind of bacteria called bifidobacterium. And then this 1% is what we consider conditionally pathogenic microorganisms. So what we're saying that at the 1% level, they're not really pathogenic. But if there is a change in our pH that affects the other vaginal flora, this other microorganisms can overgrow and they can then become pathogenic. I'm talking about microorganisms like Candida, People are quite well versed with that one. Candida is what we can cause vaginal thrush. And then we've got the others that are listed there, but Candida being the most important one. This acidic environment, like I said, keeps unwanted growth of bad bacteria and fungi at bay. Therefore, we might also find that our underwear develops a bleached appearance over time because our vaginal secretions are acidic, and that is completely normal. I do get quite a few complaints of people saying that they're concerned that their discharge is abnormal because it stains their underwear. This is completely normal, and it's specifically because of that acidity in your vaginal discharge that causes the discoloration of your underwear. So essentially, lactic acid, along with other vaginal secretions, make the vagina a self-cleaning organ, one of the most intelligent organs in the body, in my opinion. Our vaginal secretions change as our hormone levels change throughout the month. It's normal for us to have what we call a physiological discharge. This discharge is usually clear, it's thin, it doesn't cause irritation around our vagina or have a foul smell. A discharge is usually considered abnormal if it changes color, becomes white or off-white or gray-green, has a foul smell, and causes discomfort or itchiness around our vagina. If you are ever unsure on whether your discharge is normal or abnormal, please speak to your healthcare provider. This is what we're here for. We're here to help you through your journey. So please don't feel self-conscious or feel that you might experience some judgment from us. Not at all. I would rather you be educated about what's happening with your body than to not say anything because you feel that you're feeling a bit shy or something along those lines. So when we're transitioning into menopause, what happens is that, as we discussed, our ovaries start to secrete lower levels of estrogen, despite our pituitary gland or our brain producing the right hormones and the right messages to tell the ovaries to produce estrogen. These low levels of estrogen result in a decreased vaginal secretion, leading to decreased lubrication. So women might complain of some dryness in the area, particularly dryness during sexual intercourse. Because of decreased blood flow to the vaginal tissues, you're also getting some dryness in that area. Lastly, because remember our estrogen is supposed to tell our cells to produce that lactic acid. So now that we don't have a lot of estrogen, less of our cells are producing that lactic acid to keep the pH in our vagina at that optimal level. What that means is that our vaginal flora can be altered due to the increase in the vaginal pH. And lastly, you lose some elasticity in the vagina. And this can be seen by some women experiencing some pain during the first part of penetration. The dryness can cause the following symptoms. It can cause an itching and burning in the vaginal area, discomfort and pain during sexual intercourse. The itching and burning is quite important to take note of because I find that a lot of women, as they're going into this menopausal period, come in and say to me, I've got a urine infection because it's itching, it's burning in that area. But in fact, we find that it's actually not a urine infection. It's actually as a result of these changes, which is why it's important to not self-diagnose yourself. And if you are unsure, just speak to your healthcare provider who can help give you clarity on whether you're experiencing a urine infection or are these changes that are associated with the decrease in estrogen and the change in the tissues in the vaginal and urinary area, like we discussed. So as we've discussed as well, it's that, our vaginas become more sensitive to even, the smallest things or the smallest changes in our pH. One thing that I also find is quite a culprit of changing our pH or contributing to the altered flora is synthetic underwear. Synthetic underwear doesn't absorb sweat as easily as cotton underwear or other fabrics. And this wet, damp, moist area also affects the pH of our vagina. Certain bath products that we use can also throw off our vaginal pHs due to soaps or fragrances in those products that alter the bacteria in our vagina. Remember, not all of us will experience all these symptoms at the same level of intensity. Some of us might not experience any of these symptoms at all. But for those who do experience some of these symptoms, I'm going to give you some pearls of advice on how to combat them with over-the-counter products that are easily accessible to you. It's important to remember, however, that you should always seek advice from a healthcare professional if you are uncertain or have persistent symptoms. So let's talk about some of the products that are easily accessible to you and not costly. They're quite cost effective, that you can use in your everyday life to help you navigate this stage of your life. So we spoke about in bubble baths or bath products. I know that I tend to enjoy a relaxing bubble bath every once in a while, but some of us will experience some thrush or candida because of the bubble bath. This is because of the bubble bath contains soap products and contains fragrances that actually affect our vaginal flora. It affects the good bacteria in our vagina, and it allows the bad bacteria and the bad fungi to overgrow the good bacteria, causing us to have thrush. So there's these really awesome products. There's a bubble bath range that is pH balanced so that it does not alter our vaginal pH. It has no soap products, and it has no fragrance or can be lightly fragranced. These bubble baths also contain probiotics to help promote good bacteria in our vagina. So we can still enjoy our bubble baths without the fear that the products we're using in our water will actually contribute to getting vaginal infections. We sometimes experience those irritations or discomfort in the vagina related to the changes in estrogen, like we spoke about. There are intimate comfort gels that can actually soothe our vaginal area and relieve the irritation and discomfort around our intimate areas. These intimate comfort gels help to control odor. They support and restore a healthy pH balance. They're convenient and they're easy to use, and they have a light and non-greasy formula. What you do is you simply apply this intimate comfort gel, a thin layer of it, in the area where you feel discomfort, and you leave the gel there to do its job. Most of us are aware of probiotics that we take orally or by mouth and how they have positive properties or effects. And we usually give out oral probiotics when we're giving people antibiotics, just to allow the probiotics or the good bacteria to stay healthy in the vagina and the gut, while the antibiotics are doing its job in killing the bad bacteria elsewhere. These oral antibiotics assist in preventing thrush and diarrhea associated with antibiotics. But we can actually use probiotics even when we're not taking antibiotics. I found what I think is really awesome, these vaginal probiotic capsules, and they can be useful in promoting good bacteria in our vagina because we can insert them exactly where they need to work, and that is in the vagina. So we can bypass our whole gut system if we want the probiotics to work directly in the vagina. They are highly effective probiotic strains that restore the natural flora in the vagina. These probiotics attach to the vaginal mucosa and ensure that the bad bacteria is inhibited. They contribute to re-establishing the natural vaginal ecosystem and promote an optimal pH level for enhanced comfort. These probiotics play an important role in preventing candida, which is the fungus that causes thrush, and a relapse of any symptoms such as unusual odors, itching, inflammation, and discomfort. These capsules are designed to be inserted directly into the vagina. So please don't take them orally or swallow them by mouth. They need to be put inside the vagina. You can insert one capsule at night for 4 nights, and it will restore the natural vaginal flora and re-establish an ideal pH balance. It will also provide relief from intimate discomfort and irritation. With the decrease in estrogen, we can sometimes struggle to produce enough lubrication during intimate moments. And this is not something that you should feel self-conscious about because we do have a solution for that. They are lubricating, moisturizing gels, which enhance natural lubrication and assist in making sexual intercourse a more pleasurable experience. You can use these lubrications directly on your vaginal canal and vaginal opening to make penile insertion more comfortable. You can also apply this lubrication directly to the penis to add lubrication internally. These lubricating gels enable us to relax and enjoy life's intimate moments. They have moisturizing effects which soothe the vaginal dryness and discomfort. They also enhance natural lubrication. They are fragrance-free and have no soap products and are pH balanced, which means that they won't negatively affect your vaginal flora. They are non-sticky and non-greasy, and they are suitable to use with condoms. Now, the last thing that we're going to talk about is products that can help keep your vagina clean. Remember, we said that the vagina is a self-cleaning organ, and it usually only requires water to clean it in most circumstances. But sometimes we need a little bit more support, and we find that women going through menopause need a little bit more support. This is especially true, like I said, to women who are going through menopause, who do not produce enough estrogen levels that can help promote the right pH. They are ultimate intimate washes that we can use on a daily basis, and they've been designed for women who are prone to infection, whether that infection is bacterial or fungal. They wash away odor-causing germs from the most sensitive area, and they can enhance pre- and probiotic formulations. They support and restore a healthy pH balance, and most importantly, they are soap-free and fragrance-free. There are many products out there for you to try, but please remember that you are not alone in this journey. Speak to your healthcare provider if you ever feel uncertain about the things that you might be experiencing. We are here to support you through your journey and make the transition as smooth as possible. There's no need for you to suffer in silence. Find your voice and join the VTalk movement by sharing your experiences to assist and support other women dealing with the same issues as you are. So that brings me to the end of my talk today. I hope that I've given you guys just a little insight on some of the things that you might experience. I know that some of this might sound daunting or feel, daunting, but there's no need for you to be afraid. Your healthcare providers are here to support you through your journey, and please don't feel afraid to talk to them about what you're experiencing, and they can also advise you on some of the products that you can use to ease some of those symptoms. Thank you for tuning in today. My name is Dr. Sihle, your digital doctor from Prime Medical Solutions, and have a great day.
In closing, we would like to thank Dr. Sihle for her insights, and of course to you, our viewers, for taking the time to listen to our webinar on menopause. I would also like to thank Gynaguard for opening the conversation around feminine health and hygiene and how to maintain vaginal health. It is time for women to no longer be scared to discuss their intimate health, and we hope that we have empowered you to join the movement. Follow Gynaguard on Facebook for more information on other webinars and product offerings. Thank you for all your comments and questions. We will be in contact with the winner for the Gynaguard hamper. Thank you and goodbye for now.